I want to look at online supply. I'm aware that there are advertisements for online supply, the sort of thing where you fill in a form and send a photo of yourself. Is this a good way to do it?
Certainly it is a way to do it. And on a positive note, it gives wide access to an important medicine for many people who are struggling with being overweight and obese, many of whom have what we would call comorbidities and are at risk of developing or having already cardiovascular disease. So certainly making it more accessible for people is a good thing. It's not a model we would subscribe to here at Remedi Health. For us, the engagement with the individual face-to-face is incredibly important. And for us, it's important for a number of reasons. We can properly understand some of the struggles that an individual has had with their weight over the years, what's worked for them, what hasn't worked for them, what their goals of treatment are. We can talk to them honestly and openly about the benefits of treatment, but also the risks. We can demonstrate and make sure if we go ahead and supply the medicine that they know how to use it, that they understand what to do if things don't go according to plan. And we can engage them in behavioural change and motivational interviewing techniques to make sure that any supply of medicine for weight loss is combined with a broader weight management programme. Because as I said earlier, injecting this medicine will not automatically make you slim and lose weight. It does require reducing your intake, your calorie intake, eating the right foods, embarking on healthy habits for the future, and also exercising. One of the challenges with this medicine, and we know from the evidence and any weight loss program for that matter, is that the vast majority of people will go on to gain weight once they stop the program that they're on. So you end up with this yo-yoing, which is not good for your health, but it also is incredibly demoralizing and can lead to mental health issues, depression going forward. So it is important to work with an individual so that they're establishing healthier habits, that they understand that this is a long-term program for many, and that they know what to do when they come off treatment.
A lot to think about there.
I am concerned that if somebody is obtaining their medicine online, they don't, the usual safeguards that we would have by having somebody in the room with us can't be met. And by that, I mean, if somebody is requesting this online, they can put whatever information they want into a computer algorithm. And therefore, we don't know somebody's true health status, nor do we understand what their height is, their weight, their BMI, their waist circumference. We haven't talked to them about cardiovascular risk. And so for me, that's a very high risk activity in safeguarding our clients and patients, especially for those that are at risk of either having an eating disorder or developing an eating disorder.
So is it okay to advertise the supply of semaglutide? I thought direct-to-consumer advertising of prescription-only medicines was not permitted.
Interestingly, there has been a lot of promotion of Ozempic, an off-label medicine for weight loss, and in turn, I'm sure that'll come through to Wegovy, or even as semaglutide. There's been a lot of what I would call adverts. There's no finer point to it, where people are overtly promoting what is a prescription-only medicine. This is illegal in this country, and we must not and should not promote prescription-only medicines to the public.
Thanks for clearing that up. Now, the dose of semaglutide is 2.4 milligrams, but I understand that it has to be titrated up. Can you explain to us what this means in practice?
So it's really important with the GLP-1 analogues, so liraglutide or semaglutide, to titrate up slowly. The reason for that is that if we were to go in with the therapeutic dose straight away, most people would have a significant amount of side effects. This feeling of fullness, delayed gastric emptying, they probably would be sick or feel sick and may have headaches. So what we do is we titrate people up nice and slowly. So we'll stick on a starting dose, usually of 0.25 if we're prescribing Ozempic, for a month. So that's 4 weekly doses of 0.25 milligram. Then we'll go up to 0.5 milligrams for the second month. Then we go up to 1 milligram for the third month. And we titrate to when people feel comfortable. So it's important to recognize that some people might not need the full therapeutic dose, and actually they get to a dose that's high and then feel, no, I really don't get on with this. I need to come back down again. Some people start on the lower doses, accommodate it pretty quickly, but they get impatient because they feel they should be on a higher dose to get the weight loss that they need. And that's why the counselling of somebody in the initial stages until they reach their therapeutic dose is so important, to have that support, because people need to be encouraged that sticking with this, particularly when you don't feel great, is important, because you will reach a therapeutic dose when it starts to have a big impact on weight loss, but it may not be immediately.